Hi, I'm Keisha, and this is my morphine video. My client, Sue Brown, she's in pain. Oh, her bed is not actually supposed to be up. She's in pain, so she needs morphine. So I come over, I check the doctor's orders to see what she's been ordered for pain, and she's been ordered morphine. She's in quite a lot of pain because she had a ruptured appendix. So it says to give her 2 milligrams IV every 1 hour on the doctor's orders. So good. I check on the MAR to make sure she hasn't had it in the last hour, and she hasn't. And then I check the IV monograph, and my morphine comes in a ampule. It's 10 milligrams per milliliter. So on here it says I need to dilute it to 1 milligram per milliliter. And it says to give it over 2 milligrams over 2 minutes. Or 2 milligrams over 1 minute, so I'm going to give the whole dose over 1 minute. It says I need to do baseline vitals, and I just check to make sure that it's compatible with normal saline that I'm mixing it with, and it is. Good. So then I do my math to see that I'm going to be giving the 2 milligrams is going to be in 2 milliliters. That's what I'm going to administer. So I mix it with 9 milliliters normal saline, and then I'm going to waste 8 milliliters and give 2 milliliters. So I get another nurse to check my math, and then I perform hand hygiene so that I can grab my medication and prepare it. So I take my medication out of the Omnicell. It should be an ampule, but there's no more ampules left in the Learning Center, so I'm using a multi-dose vial instead. So we're going to pretend it's an ampule. As I take it out, I do my first set of checks, 7 rates. Patient, Sue Brown, drug, morphine, dose. She's going to have 2 milligrams. That's diluted to be 2 milliliters. Route is IV. Reason is for pain. Time, make sure she hasn't had it in the last hour, and she hasn't. And documentation, make sure that it's on my MAR, my other documentation. Good. So now that I've done my checks, I can get the drug ready. So I'm going to clean the top of the vial for 15 seconds, which I wouldn't do for an ampule. I would just snap it and use a filter needle. So that's what you'd like to see me do, but I can't. Okay. Now that I've cleaned that for 15 seconds or snapped it, I need to take my syringe, attach it to a needle, use a no-touch technique to keep it sterile. Safe. And draw up 1 milliliter of air, which I wouldn't do if it was an ampule. You don't need to draw up the air. So take out 1 milliliter. I've struggled to get the pressure just right in this. It's not really just right at all. Okay, so I'm just gonna draw up more than I need so that I can, oh, where's my pen? So that I can tap the air out. There, all the air's at the top. I can push. So now I have 1 milliliter, as you can see. Okay. So now I'm going to do the one-handed. I have such a hard time with the one-handed recap because I don't have a steady hand. Okay, so now that I've drawn that up, I'm gonna do my second check, 7 rates. Okay, I'm done my second check. Now I'm going to get my thingy-majigger. I call it a little Lego piece because I forget what it's actually called. I'm gonna get a saline, get the air out of it, and blue to new. So I'm attaching this, I'll get the air out with a no-touch technique to keep it sterile again. And then I'm going to take this needle off, put it in the sharps. So I'm gonna have another nurse with me while I do this all, checking the dose, and most importantly, watching the wastage, and we have to sign on a narcotics waste sheet thing, which I don't have, but just so you know, the thought was there. So now I've pulled back to get 10 milliliters, which means that my medication is sufficiently diluted. So now with another nurse present, 10 milliliters, with another nurse present, I'm going to waste 8 milliliters into the sharps or another appropriate receptacle. Now I have 2 milliliters. I've continued to make sure that the tip of my syringe has not touched anything, keeping it sterile. And there. So now I'm going to add a label now that I have my dose. Morphine, blah, blah, blah. And now that I have my appropriate dose drawn up, I'm going to do my third check. 7 rates, blah, blah, blah. Now that I have my medication ready, I'm going to assess what else I need to bring in the room with me. Well, I'm gonna need a pen. I'm gonna need 2 posi flushes. I'm gonna need 100 alcohol wipes, and I'm gonna need my patient's MAR. So now I'm going to go into the room. When I go into the room, I'm going to put my things down, immediately perform hand hygiene, introduce myself to the patient. Hello, Sue, my name is Keisha. I'm going to be your nurse today. I hear you're having some pain. You are, okay. So I'm gonna do her baseline vitals machine right here. For the purposes of this video, I won't make you sit through the vitals, but I would do that first. Paying special attention to respiration rate, because that can go down after morphine. I'm going to take my MAR, compare it against her bracelet, ask her her name, comparing what she says to this, ask her her date of birth, compare, and I'm going to compare her MRN. I'm going to ask her if she has any allergies. This one says NKA, which it definitely should not say because she's allergic to tetracycline, but I don't have the proper bracelets. We'll pretend that says tetracycline. Okay, that's good. I'm not giving you tetracycline, so you're okay. Okay, so now that I've checked everything, cleaned my hands, baseline vitals, now it's time to give her her medication. So the first thing I have to do is I should get the air out of this first. So I'm gonna go like this. Whoops, okay, that's fine. Sterile no touch technique to the top. Grab my alcohol wipe. Clean this for 15 seconds. Unclamp. Use a no-touch technique as I attach. Then I'm going to aspirate, looking for blood return. And then I'm going to push 1 to 2 mils, ever so slowly. And I'm assessing the site. I'm looking for swelling, coldness, infiltration, phlebitis, asking the patient, does that feel okay? Does that hurt? Okay. And then I'm going to do the push, push, pause thing to push it under pressure. Clamp under pressure, good. Now I can give the medication. Now my IV monograph said to give 2 milligrams and 2 milliliters over 1 minute. So as I give her this medication, I need to clean this port again for 15 seconds and then use a no-touch technique as I connect and push this like ever so slowly. Oh, unclamp, of course. Push this ever so slowly over 1 full minute. So I'll be watching the clock. I want to get to the 1 mil at the 30
second point. So I'm just gonna push this a little faster, but we'll say that I did it over 1 minute. I just won't put you through that. Okay, now I clamp. Now there may still be some medication in this little tubey thingy. That's the technical term, tubey thingy. And so I need to, when I attach this posiflush, which I'm gonna get the air out of, when I get the air out of it, and then when I attach this, for the first 2 milliliters of this, I'm gonna put it in at a very slow rate again, 2 milliliters over 1 minute. So I've got this open, I'm using a no-touch technique, making sure not to touch that. Clean this for 15 seconds. Good. Then I'm going to attach this. And then unclamp this, very slowly push it the first 2 mils over the course of 1 full minute. Okay, so 1 full minute goes by. Okay, now that 1 full minute has gone by, I'm going to push a little faster. So we'll do the push, push, pause thing again. Half a mil, half a mil, half a mil, and then you push the whole entire rest of the vial, not vial. What is this thing called again? Syringe. Woo. Then I'm going to take this stuff, throw everything in the garbage. I won't though, because I'm going to keep this. Okay, so we'll pretend I threw all that in the garbage. And then I'm going to document by signing my MAR. I should have dotted the MAR earlier, but that's okay. I'm remembering to sign it, so that's the important part. And yeah, that's it. Oh, and then I'm actually gonna come back here in like probably less than 10 minutes just to like check her respiration rate again, to make sure that the respiration rate has not gone too low. With morphine, I'm just gonna do a little bit of extra monitoring of my client and make sure she's comfortable, doesn't need anything else, call bells in reach, and good, cut.